name is Kieran Richards. Today we're doing the flexion adduction extra compression test. And the positive test would be reproduction of symptoms, and it could be indicative of labral pathology. So we'll flex the hip, we'll adduct, and then we'll put an axial force on the femur. And do you have any symptoms? Nope, so it's a negative test.
Alright, I'm Reed Newey, and we're doing the flexion adduction internal rotation test. So I'll passively flex the knee, adduct it, and internally rotate it. And for this, we're looking for any labral pathologies or impingement. And a positive test would be any reproduction of symptoms, including pain or anything. Are there any symptoms?
Sir.
Perfect. Negative test.
I'm Shane Yoho. We're doing the hip scour test. So for this, you would passively flex the knee, and get axial compression, and then you're going to move the hip through the arcs. And for this, you'd be looking for reproduction of symptoms or any pain, and that would be a positive test.
All right, my name's Mitchell Bunn, and we're doing the Kendall test. So we're looking for tight hip flexors. What we're going to do is we're going to have the patient hug their leg, grab this one, hug it to their chest, and if this leg extends past 90 degrees, then it's indicative of tight hip flexors.
And doing the Trendelenburg test, this one, the subject will lift up their leg. It could be either one, we'll do both. With the left, we'll look for the non-weight bearing leg, non-weight bearing hip to drop. If so, then it would be indicative of a weak gluteus medius. Neither drops, so it would be a negative test.
Alright, this is the piriformis test. We're testing for tight piriformis. So we're going to have the patient on their side, and slightly bend their knee, and we're going to push it down. And if there's any pain there, that would be a positive test. And if the patient is a little more flexible, we can have them lay on their back, and we can bring the leg up and pull it over. Same thing, look for pain.
Okay, this is the femoral nerve traction test. For this one, you'll have them on their side, you'll bend their knee, and you'll push here on their hip, bend their knee to about 90 degrees, and then you're looking for reproduction of symptoms. You'll go back nice and slow until they tell you if they feel any pain. For this, a positive test would be the reproduction of symptoms, and negative would be no symptom.
Okay, so this is the straight leg raise test. We're looking for neural pathology here. So what we're going to do is we're going to passively lift one of their legs until there's a reproduction of their same symptoms. So tell me when. There. We're going to back off just a little bit, and then we're going to dorsiflex the foot. And if those same reproduction of symptoms occurs, then it's a positive test.
Valsalva maneuver here. This one will be testing for neuropathology. So the patient will make a fist with their hand and bring it up to the mouth and blow through it, compressing all the air out of their lungs. And if they have reproduction of symptoms, then it would be a positive test.
Alright, this is the SI compression test. We're looking for SI dysfunction. So we're going to find that ASIS. Bring both hands, and we're going to push down and out to compress that SI joint. And a positive test for this would be any pain.
Okay, this is the SI distraction test. Here you'll find the ASIS, and then you'll push in, and you're looking for any pain in SI joint.
Okay, so now we're doing the SI dysfunction screen. So we're going to do a couple of different tests here. The first one, you are going to find the medial malleoli of the legs and just kind of loosen them up here. If one is longer than the other, then that would be a positive test. And then what we're going to do is we're going to move them into a seated position. So if you want to get up. And now we're going to find the PSIS and have them bend over, bend towards the front. So this should roll up. If one of them were to roll down, that would be a positive test indicative of that SI dysfunction.
We're doing the stork standing test. I will have our subject here raise or flex their hip on one leg and lean back. And we'll do that for both sides. and we're looking for reproduction of symptoms, and it'd be indicative of spondylolysis in the weight-bearing hip.
Next, we're going to do the Hoover test, and this is going to be testing for malingering or if the patient is faking an injury. And so what we're looking for is going to be a lack of pressure here. So I'm going to ask the athlete to raise one of their legs. I'll have you raise your left leg. I'm going to be feeling for pressure in the other leg, and if they're not able to lift their leg and there's a lack of pressure here, that would be a positive test.
Okay, this is a lateral rib compression test. For this one, you'd be checking for pain or a fracture in the anteroposterior ribs. So you would just push here on the ribs, working your way up and down. And if there's any pain, that would be a positive test.
All right, now we're doing the anteroposterior rib compression test, which is similar to the lateral one, except we're going to go front and back on the ribs. So we're just going to give that same amount of pressure up through the ribs. And if there's any pain or crepitus, then it would be a positive sign.
We're doing the cervical compression test here. This one we're looking for nerve root pathology. So I'll have the subject sit seated like this, and we'll press down on the cervical spine. And if there's any reproduction of symptoms, then it'd be a positive test.
Alright, next we have the shoulder depression test, and this is looking for any brachial plexus traction injury. So I'm going to push down here on the shoulder and push against his head, and we're looking for any reproduction of symptoms for a positive test.
Okay, this is the Adson's test. For this one, you will find their pulse on their wrist, have them straighten out their arm here, and bring it back. And then I'll have you look this way. For this, if there's any numbness or diminished pulse, then that would be a positive test.